Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association with Chief Operating Officer Kyle Longton. Be sure to subscribe to us on your favorite podcast channel. Enjoy the episode.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and along with me as always is
Hannah Wolfhard. And today, we've had a number of episodes, Kyle, on behavioral and mental health. And both of us have shared some experiences of seeking behavioral health help. We actually had our first episode about My Strength, a program that as an FSBP member, you can have access to My Strength. It provides you with resources to help overcome depression, anxiety, and substance use disorder. And we did another episode early on about Able To. And Able To is a web-based video conferencing program that helps individuals live with conditions like heart disease or type 2 diabetes, chronic pain, or that experience life events such as losing a loved one or having a baby.
Right. We also had a great talk about opioids and substance use disorder, and part of that was a focus on the mental health and behavioral health needs that come along with using opioids and perhaps even abusing opioids. But most of our conversations and most of the programs that we featured have focused on adult needs. Not all of them, but most of them.
Correct. So we did do one episode on LGBTQ plus youth and talking a little bit about their behavioral support needs. But as you said, most of the conversations have been focused on adults. So it's nice that this episode, we're going to take a turn and focus on kids. And for our episode today, AFSPA talks behavioral health support for kids.
Absolutely. And behavioral health needs are not something that suddenly appear when we hit a certain age, that we turn 18, we can vote, and all of a sudden we have behavioral health needs. They can show up earlier.
Yeah, definitely. And kids are unique and their needs are unique. And oftentimes the support they need is very unique. And many times their parents need tools to help support them. And as we know, the pandemic has exacerbated those needs, not just for kids, for everybody. But luckily, it's also amplified the innovative solutions that are available with something like Brightline.
Yeah, absolutely. And Brightline is something that I came across when I was reconnecting with someone who I previously worked with at Livongo. And we'll be talking about actually Livongo in an episode in the month of November. But that's another remote solution. And so Brightline they describe themselves as bringing exceptional behavioral health care to kids, teens, and their families when and where they need it. And essentially, it is virtual care for behavioral health needs focused on the under 18 crowd. So it can be children of all ages into the teenage years. They also offer support for parents. And we're going to talk about that some with our guests today, but it is a completely online virtual experience that offers resources. They offer webinars, they offer support groups, they offer coaching. They also offer what we think of as traditional care with licensed clinical social workers, psychiatrists, and so forth. But there's different levels of care for different needs. Because as you mentioned, needs are unique. Not just kids' needs are unique, but individuals' needs are unique. And we are fortunate enough to have someone who has a fantastic background in the needs of children, but also is deeply connected with Brightline. And that is David Groedberg, who is the Chief Medical Officer and Psychiatrist for Brightline. He's a board certified child and adolescent psychiatrist and has over 20 years of clinical experience providing evaluation and treatment for children, adolescents, and their families across many conditions and levels of care. David is currently a faculty member at the Yale School of Medicine and served as medical director of the Yale Child Study Center Outpatient Clinic. Among his many contributions to the field, David developed the Autism Mental Status Exam, AMSE, which is a brief and free diagnostic assessment for autism spectrum disorder used globally. So many of us, I know I've seen this in my pediatrician's office, many of us will encounter it. Much of his work at Yale has focused on using technology to improve the way pediatric behavioral health care is delivered. It's perfect for us and for today. And also during the course of his career, he has worked with foreign service families and understands both the unique needs they have and the solutions offered by telehealth. David went to medical school at the Albert Einstein College of Medicine and trained in child and adolescent psychiatry at the Yale Child Study Center. He received an NIH-sponsored National Research Service Award, that's T32, a Career Development Award, KL2, and foundation support for his clinical research. He's a resident of New Haven, Connecticut, where he and his family enjoy pizza, sports, and hiking. Thank you, Dr. Groedberg, for joining us to talk about the behavioral and mental health needs of children and adolescents.
Good morning.
I'm just going to jump right in. FSBP has had a focus on mental wellness, particularly how it relates to physical health, since early 2020. But much of our focus has been on needs and programs that we offer for our adult members. But obviously, they're not the only ones who need support and treatment. Your specialty is focused on children. Can you tell us a bit about some of the most common behavioral health needs that kids have?
Yeah, absolutely. So the most common reasons that children get referred for behavioral health services include what are called externalizing behaviors. So like ADHD or oppositional behaviors, those are the most common. And before the pandemic, it was about 9-10% of the population of children had those difficulties. And after that comes anxiety and depression, and then autism comes in at about 1%. And since the pandemic started, rates have just skyrocketed. And we're seeing all of those clinical domains, but just at much higher prevalence rates. So kids who had pre-existing difficulties before the pandemic are now coming in with more difficulties. And kids who may have just been vulnerable beforehand are now coming in with new symptom presentations.
Yeah, and you mentioned the pandemic. Of course, we can't really have a conversation about anything, particularly healthcare, without talking about it. And the last year and a half had taken a whole toll on all of us. You mentioned some of the challenges, and the greater prevalence you're seeing in kids. I know from my own personal experience that the pandemic's had an effect directly on my kids, and also the effects it's had on me have spilled over to my kids. Can you talk about, you touched on this, but can you go a little deeper on how kids have been affected, sort of the immediate effects on kids over the last year and a half, and what we might see going forward?
Yeah, for sure. And I'll actually start with the parents and then move on to the kids. But, as a parent myself, we've been tasked over the last 2 years of creating highly structured learning environments at home, especially during the lockdown periods. And as parents, we had to do that without any of the training that teachers have, without any of the resources that schools provide. And it's not easy. I know some people who are able to do it, but for most parents, including myself, it was a very difficult thing to do, especially when trying to work from home at the same time, or when there may be other siblings that you have to take care of, and all the while trying to protect your family from not getting sick. So just a tremendous amount of stress that parents have had to endure. And whenever there's more stress and adversity, children become vulnerable to developing more anxiety and more depression and more disruptive behavior. So that's sort of the context in which we've been trying to help families and children with difficulties.
Okay. And so we have an idea, and I think all of us in our personal lives who have children or are in contact with children, have seen some of that, and we've tried to deal with it in different ways. Like you said, even without training, we've turned on to Google searches and things like that. My family started having a family scream session on a daily basis to try to relieve and release some of what we were feeling. But I'm guessing that there are more effective treatments out there than just a good family scream. Can you tell us a little bit about what some of those traditional and even the more innovative approaches are to supporting kids' needs?
Yeah, sure. And the family scream session sounds amazing. Maybe not for the neighbors. I'm not sure, but I actually, when I think about it, I mean, of course, it might feel good to really let it out in a scream. But the way you describe it, it's a collective experience and something that your family was doing together. And working together to solve a problem is actually one of the core pillars of family resilience that we think about when we work with families. So I think it's a wonderful example that you shared, and thanks for that. As far as traditional approaches to pediatric behavioral health, there's a lot of evidence-based interventions that are out there, including cognitive behavioral therapy for children, family-centered approaches, medication management. But there's just no easy way for families to get access to these treatments. And of course, access is one of the biggest barriers. There's simply not enough clinicians trained in pediatric behavioral health. But another big barrier includes the stigma that, despite the cultural shift that we're all experiencing of destigmatization of mental health problems, it's still there. And a lot of parents are hesitant to have to label their child or to have to get a mental health diagnosis to get help. And people are worried about, a label sort of sticking on a child's records at school or, in medical records. So there's no easy way for families to do this. And because of that, care, people wait for a crisis. They're forced to, and care becomes much more reactive instead of proactive. And that, by definition, is just more expensive care. It's less standardized, and it's harder to do. At Brightline, what we're doing is not only are we developing a multidisciplinary clinical service, which we have now launched across the country, but we also have other levels of care that parents can easily enter and get engaged with. And the most basic level is called Brightline Connect, which is more of a self-guided, digitally supported psychoeducation type of experience where people can get engaged. And then when they're comfortable, they can move into a skills-based coaching intervention or a more traditional clinical intervention. So I think the interventions are there. We just need to deliver them in ways that meet families and children where they are.
So let me ask a little bit then about, because we're talking about Brightline, and it's sort of filling a space in the healthcare arena that has been empty, that there's sort of been a void. We've had online options, online support programs for adults. Our FSBP, our health plan, has been engaging in those for a decade now and looking for solutions, but there hasn't been much out there for kids. And I'm so glad, that's why I was so glad to find Brightline when I came across it. Can you talk a little bit more about that three-tiered approach, and then particularly talk a little bit about the difference between sort of the coaching and the care levels?
Yeah, for sure. So the three-tier approach is really supported by, at its most basic level, Brightline Connect. And what we've been able to do is build a digital platform that anybody can access. And you don't need a diagnosis to access it. And you can access it as a parent. And what you immediately are able to encounter are evidence-informed psychoeducation materials, some basic skills that parents can use for severe tantrums, for example, in their children, or guidance on how to interact with a school to, if you're about to start an IEP process, for example. And for many families, that self-guided intervention is really all they need, at least at that moment. For other families, they need more, but they weren't necessarily ready to enter the clinical care for all kinds of complicated reasons. And for such families, after they get engaged, they can move into a coaching program. So coaching is something that's been used a lot in behavioral health companies, especially those that are working with adults. And the difference between coaching and therapy is that coaching is strictly skills-based intervention. So you're not doing psychotherapy with a client, but you're actually working on very specific protocolized skills. So for example, at Brightline, we have coaching programs that work on organizational skills training, for example. So a parent whose child may have ADHD or just some difficulties with executive functioning, it's really difficult to get help for that. So we have training programs that were developed by occupational therapists to help parents implement evidence-based practice that help support their kids' executive functioning and organizational skills. Another example of a coaching program is something that helps parents with children who have anger outbursts or severe tantruming. And the first line intervention for children who have disruptive behaviors or anger outbursts, according to American Academy of Pediatrics, is parent behavior training, where parents get trained up in some really specific skills and strategies that they can use. And it works. But sadly, only 3 out of 10 families across the country have access to parent behavior training. So we want it to be available to 10 out of 10 families who enter our system. And that's one of the coach-delivered programs that we have. So hopefully that gives you a sense of the types of programs that we're offering. And then, if there's a clinical indication for a higher level of care, that is clinical services. If a child has a clinical level of anxiety or depression or complexity in their difficulties, that is, comorbidity or medical difficulties, then we move them into clinical care and guide the parents to enter that. And that's much more of a traditional clinical service. What we've built is unique in that we have truly multidisciplinary care teams. So right now, even when you do get to clinical care for pediatric behavioral health, it's quite fragmented and siloed. And what we've been able to build using our digital platform, our electronic health record, our care plan, is we have everyone working together. So that sets us up to do pretty exciting stuff like sequencing care in a way that works, making sure that everyone's on the same page, engaging families to be part of the decision-making for their child's care plan. And we're able to do and anchor our care on evidence-based practice like cognitive behavioral therapy.
Well, I love to hear the term, may put some people to sleep, but hear the term evidence-based, because I know that means that you all aren't just trying different things. You've got a psychiatrist, you've got other trained medical professionals who are leading these efforts. And I think that brings me to the question of, is behavioral support as effective in the virtual space as in-person options? And I'm assuming the answer is yes, but I'm wondering if you can give us a little bit more about specifically in the pediatric area, the efficacy of virtual treatment.
Yeah, sure. So before the pandemic, people were thinking about this quite a bit, and there was a lot of work demonstrating that the efficacy of behavioral health interventions over telehealth and comparing them and demonstrating that they're equally effective. And then without any anticipation or predictability, knowing that we were going to all do this, the entire industry shifted to telehealth over the past 2 years. So we've learned a tremendous amount. And what we found is that, a lot of children and families are able to engage over telehealth. And some actually prefer it. There's some surveys out there now that when given the choice, some parents and children prefer to have the telehealth session from home. I think typically when parents are managing their child's behavioral health problems, they'll spend many hours per week driving to the office, parking, waiting in the waiting room, coming back home. So it saves a ton of time for families and takes a large burden off of them. A lot of our therapists also have told me that there's something so valuable in seeing children in vivo, that is, in their environment, and when children are able to share a toy with the therapist or their pet, that's a very common event that kind of facilitates the communication and interaction between them. There's also lots of opportunity for us to engage parents because even though parents might be working, they're home when we're doing the session with the child. So we're able to make sure that the parents are learning the same skill that we're teaching the child and send the parents off to practice that skill in between those clinical appointments. And that's actually a critical aspect of what we do. And we call it dyadic care. And it's basically engaging and enlisting the parents to do a lot of the practice and supporting the child in practicing their new skill in between those sessions, so we can really generalize kids' new skills and get them back into their developmental trajectory.
That's fantastic, and it goes along obviously with what you were talking about earlier in terms of the parent behavior training and some of the pieces that are available through the Connect and the coaching to combine all of that for the whole family. Because I speaking with a colleague of yours, and we talked about sort of parents being the first line of support and the first line of recognition that there's a challenge. And so the innovative way that Brightline has approached care for not just the child, but the whole environment of the child, and particularly the parents and maybe other family members, is incredible. And I know as a parent and someone who sought support as when I was a child, and then also sought support for my children, how important that is to have everybody involved. And do you see that parents are staying involved even at all ages for teens as well as younger kids?
Yeah, people are staying involved. We have good completion rates, and our summaries of our outcomes are quite positive. Another aspect, and another reason engaging parents is so important is not only so they can help support the child in their new skills, but we know just from research that when parents are able to use these new skills that we teach them with fidelity, and if we help parents develop a sense of self-efficacy, meaning they feel like they can help their child and they don't feel helpless, that lowers the parents' stress levels. And when parents' stress levels go down, that predicts improved outcomes in the child. So it has a profound impact on clinical outcomes in the child. And then, of course, for parents who are working, when parents are more stressed out, we all know this, it's harder to focus on work. So you just become less productive. And there's problems of absenteeism and presenteeism. And then when we're more stressed, we use our benefits more and for stress-related conditions, whether we have high blood pressure or diabetes or you name it.
Yep, we've talked a lot on this podcast and in other publications and so forth that we have about sort of this connection between mental and physical, and how they, the mental can lead to poor physical outcomes, the physical challenges can lead to mental and behavioral challenges, and that they're combined. And I think I appreciate the way that you all are approaching that for the whole family, and trying to intervene to provide the best possible outcomes. I do want to switch gears for just a minute and talk about one of the other services that you all offer, and that is speech pathology. And that is not something that I immediately think of as a behavioral health need, or something that I always, again, think of that could be done effectively in a telemedicine environment, but you all are doing it. So can you talk a little bit about the approach that Brightline takes to speech pathology needs?
Yeah, so they're quite prevalent, and speech pathology needs can take the form of expressive difficulties, like language delays, receptive difficulties. So kids have a hard time understanding language, articulation, and also just using language in a socially in a communicative way. So like children who are on the autism spectrum may have some social communicative difficulties. And children who have these difficulties typically are getting services through school or through preschool, like through an IEP, or they were getting it independently, privately. But all that got interrupted during the pandemic. And when kids have these difficulties, there's a really high rate of comorbid behavioral health problems. So that's why it just makes sense and for us to include this in there. And the speech language pathology world has been able to adopt to telehealth. And there's some things that are a little bit more challenging, but for the most part, there's been some significant success in working with children and families in those different domains that I was describing. And especially for the younger children, there's a big role that the parents play in again practicing a lot of these skills. And we've had success with that. We're also really excited to be launching our autism program next year, which will have a big focus on social and communication skills. And at the beginning, at launch, it'll be very much focused on empowering parents with the skills that they need to really promote their children's development.
I'm very excited about that, and I had heard whispers about the autism program. I wasn't sure if the time was right to talk about it. I know it's not launched yet. Is there anything more that you can share with us about that program and the approach it'll take, and how it might go about supporting people with autism spectrum disorder?
Yeah. So as a child adolescent psychiatrist, I worked for years with children and families who are coping with autism, and the behavioral health needs can be quite extensive. We're starting with an area where we can scale things as quickly as possible and help the most families that we can. So we're launching a coaching program where coaches are working with parents in a parent-focused intervention, skills-based intervention, to teach parents to use naturalistic forms of behavioral interventions. And these are things that are evidence-informed, and they really help focus on the social and communication development of children. So these are skills that have been shown that they can be taught to parents by both clinical therapists, but also by coaches, and parents can get fidelity and achieve self-efficacy in these skills. So we're really excited to get these skills-based programs out there, and then from there we'll keep building and addressing all the many other complex needs that families have.
I think that's fantastic, and those who take advantage of it, I think it will be lucky to have you and your extensive experience sort of leading that effort and making additions as time goes on. Before we finish, I do want to ask, do you have any advice for our listeners? I think most of them would fall into the parent category, but do you have any advice for them in recognizing and supporting their children's behavioral health needs?
I think the best advice is that parents should really trust their instincts, and I think parents usually know if they're worried about their child or if they're something concerned, or if they're not. Often pediatricians will tell them, or teachers will tell them. So just I think the advice I can give is to be on high alert. Everyone is more stressed now, and everybody is more vulnerable to developing anxiety or depression, or in kids, things come out more frequently in their behaviors. But I think difficulties are so prevalent now, so we all tend to normalize this and accept it. But I think if things are really getting in the way of a child's development and their functioning at home, that is, families feel like they're really needing to interrupt their family routines because of a child's difficulties, or it's really getting in the way of school or social interactions, then it's worth reaching out to the pediatrician or finding out how to get connected with a service like Brightline. As we come out of the pandemic, children are just more vulnerable, and they'll continue to be vulnerable for a while. So it's not just a problem now that we have to address, children's anxiety and depression and behaviors, but we have to really set up services that are going to be there for the next several years, at least, because I think the difficulties that kids are enduring, or the stress that they're enduring now is going to manifest in difficulties over the next many years.
I think that's great, and relying on that relationship with the pediatrician, with the primary care provider, and seeking advice there. I think that's fantastic as a starting place, and recognizing that times have changed for all of us. But luckily, so have the solutions. And I really appreciate you taking time today to share one of the most innovative solutions we've come across, particularly for children, which is Brightline Health. So Dr. Groedberg, thank you very much for joining us for this episode.
It's my pleasure. Thank you very much.
To learn more about Brightline Health, please visit hellobrightline.com. Thanks for joining us for this episode of AFSPA Talks, a production of the American Foreign Service Protective Association. Please subscribe, rate, and review the show, and tell your friends about it. We welcome your feedback on LinkedIn, Facebook, and Instagram. Look for @AFSPA Cares. All information offered in this podcast is meant to be educational. Comments offered by the hosts or guests are not intended as medical advice. Please direct questions about your personal health needs to a provider. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA, the policy provisions will prevail. Special thanks as always to Hannah Wolfhart for producing, editing, and mixing this episode. We'll see you next time.